Good day, doctor. Can we get to know you?
Yeah, good day, sir. I am Dr. Panebi Bostrosi. I'm a senior consultant gynecologist.
It's a pleasure meeting you, sir.
Thank you very much.
What are uterine fibroids?
Uterine fibroids are benign monoclonal tissues or tumors on the uterus, which is commonly known as the womb.
What are the common types?
The types of uterine fibroids are classified or named according to the parts of the uterus which they are located, including the fundus, which is the largest upper part of the uterus, the cervix, the sides of the uterus, which are known as the broad ligament. And also it can also be classified according to the layers of the uterus which they are found, which could include the outer part, which is named serosal uterine fibroids, the middle part, intramural uterine fibroids, and the innermost part, submucous uterine fibroids. Additionally, there could be some fibroids that will be seen inside the womb. These are polypoid uterine fibroids. So these are the broad categories which we classify them as.
What are the typical symptoms that patients with uterine fibroids experience?
Okay, in this environment, or the typical symptoms we would attribute to the presence of uterine fibroids would include the presence of a mass or a swelling on the lower part of the body. It would cause pain for most people. This is a very common complaints that patients come with. Some patients they have complaints of abdominal bleeding. We call them abnormal uterine bleeding. Also, the fact that abdominal uterine bleeding, which could be excessive bleeding or bleeding between menstruation, and also we have the closest structures around where the womb or uterus is. In front we have the bladder. We could have abnormal obstruction of the ureter, which would cause cessation of urinary drainage or urination, or also posteriorly, which has to do with where the food or the food tract passes. They could have constipation. Then also, one of the common prevalent symptoms that makes patients also present with, it's associated with infertility. So those are the most common symptoms patients with uterine fibroids would always present with in this environment. The cause of uterine fibroid has not been exclusively been identified. However, we know that it's prevalent in the blacks, especially Africans and African Americans, and we attribute it mostly to the diets we have. We've not identified the specific diets, but diets in the African continent has a significant contribution to the development of uterine fibroids.
How are uterine fibroids diagnosed?
Diagnosis of uterine fibroid would include a patient presenting with general complaints, and these complaints commonly would include an individual having abdominal swelling, which could signify that uterine fibroid is large size, or abdominal pain due to the presence of uterine fibroid in a space or a position which it was previously absent. Also, these complaints of excessive bleeding during menstruation or in between menstruation, and difficulty in urination, constipation, and also complaints that look like swelling of the body, the swelling of the lower limbs, which would also indicate that there is a compression effect on the ureters, which are the drainage channels of urine in the body. So these are complaints that patient will present with, and after presenting with those complaints and a checkup, investigations are done, an assessment of uterine fibroids could be made.
What are the common treatment options?
The common treatment options are actually tailored to what the patient desires. So commonly, patients' treatment will be categorized into conservative treatment, medical treatment, and surgical treatment. For conservative treatment purposes, patients are generally followed up to see if the normal cyclical hormonal changes would cease and patients complaining for the symptoms would have reduced significantly. Alternatively, medical therapy is the next category of treatment options that we have. Now, the medical options of treatment, it's actually tailored to manage specific symptoms for the patient. So a patient that has pain as his major complaint, the treatment is targeted to ameliorating pain complaints. If excessive bleeding is part of the patient's complaint, that's treatments tailored to reducing excessive bleeding will be looked at. Also, for the definitive treatment, which is mainly surgical, would be looked into in the form of removing the mass. These are commonly used for fibroid tissues that are usually huge. So removing the mass, which could be by myomectomy, which would have options of open abdominal myomectomy, laparoscopic myomectomy, or hysteroscopic myomectomy. Also, the definitive treatment, which would ensure that the tissues that are generating the uterine fibroids are removed as well, that's hysterectomy. So total abdominal hysterectomy or total hysterectomy, which would include removal of the uterus and the cervix, is the definitive treatment of uterine fibroids. So this takes care of the three major modes of treatment of uterine fibroids.
What are the complications that can arise from untreated uterine fibroids?
Uterine fibroids are typically uncontrolled growth of uterine tissues. So if uterine fibroids are not treated, we would know that the symptoms of uterine fibroid would keep worsening. So all the attributed symptoms that an individual has would worsen. The complaints of excessive bleeding would worsen until the patient stops having the cyclical hormonal changes. The complaint of pain would gradually worsen. And also, if other associated features like infertility is associated with the patient's uterine fibroids, that complaint will not be corrected until treatments are done. Also, we have a small proportion of individuals that have uterine fibroids that may have malignant transformation. That we mean by transformation or changes of the initially benign or quiet uterine fibroid to cancerous tissues, but the percentage of fibroids that transform to that is relatively low.
Can uterine fibroids affect fertility and pregnancy? How?
The relationship between uterine fibroid and fertility, it's not clear-cut. Why we say so is we have patients with uterine fibroid that are pregnant. Now, the way we describe uterine fibroid and fertility would be if other common causes of fertility has been ruled out and the patient has uterine fibroid, we say the uterine fibroid is likely the cause of infertility. Now, for uterine fibroid and pregnancy, we have varying associations because we know that some patients have coexisting uterine fibroid and carried pregnancy to term and have deliveries. However, also it's common that patients with uterine fibroids and pregnancy have common complaints. Earlier in pregnancy, especially the first 3 months of pregnancy, they have recurrent miscarriages. And also in the second half of pregnancy, due to the expanding size of uterine fibroid and also the relationship between an expanding mass and probably the loss of its own blood supply, would cause severe pains. And we've seen cases where the extent of the pain is definitely uncontrollable and patients even ask for ending of the pregnancy. And also for the end of pregnancy or time for delivery, we've seen association within excessive bleeding during delivery and uterine fibroid that would even make some patients have surgical delivery, and also concomitant attendance of uterine fibroid during the surgery or cesarean section during delivery.
How do you differentiate between fibroids and other gynecological conditions with similar symptoms, such as endometriosis?
Okay, they look similar because they exist at the same area of the body. However, differentiation could be done through the symptoms they present. However, the differentiation between uterine fibroid and adenomyosis, it's not clear-cut because adenomyosis is also a set of tissue that exists inside the uterus. There are also tissues that are developed from the uterine tissues. There are tumors or swellings that develop from uterine tissues. So however, for endometriosis, they don't exist inside of the uterus. So the common way to identify them is from the symptoms and also radiological investigations like ultrasound scan, magnetic resonance imaging. When these investigations are looked into or interpreted by the radiologists, the differences would be identified.
What factors do you consider when developing a personalized treatment plan for patients with uterine fibroids?
Patients presenting with complaints that we have identified or make a diagnosis of uterine fibroid, the personalized treatment plans would consider what are the patient's desires. Now, if the patient desire is just to control pain, which is the most pressing complaint for the patient, it will tailor toward addressing pain. Other symptoms like heavy bleeding could also be identified. However, if the complaints have been looked into and noted that minimal control of these symptoms are not going to be addressed directly, one is going to discuss with the patient of the options of removing the uterine fibroid and surgical options. So we initially said surgical options are a fair way to treat, because if the complaints the patient has are triggered by the presence of uterine fibroid, if the fibroids are removed from the uterus or from the body, definitely those symptoms would be absent. So that's the way we plan or tailor our personalized treatment plan for the patient. Also, we look into between the definition of total hysterectomy and myomectomy, the patient's fertility desires are always considered.
How do you approach counseling patients about treatment options, particularly regarding fertility preservation and the risk associated with surgery? How?
Okay, when we consider patients' treatments with regard to the uterine conservation or fertility conservation, the major direction which we are aiming at is myomectomy, which means we remove the uterine fibroids, preserving the uterus. Now, we know that of all the gynecological surgeries, uterine fibroid surgeries are next just to cancer treatment of cancer, surgical treatment of cancers. So the fear of excessive bleeding, that's the major concern. So the discussions with the patients would be based on the experience of the surgeon, the number of surgeons that are going to be available, and also the extent of the likely surgery, and also considering if there are previous surgeries that have been done. These are factors that worsen or makes the surgery more complicated. So if these ones are ruled out, then the options of surgery are going to be looked into. Whether laparoscopic surgery and open surgery or hysterectomy surgery would going to be looked at. And these are ways we go about assessing the extent of the surgery or the possible complications that we anticipate. So if the complications are anticipated, precautionary measures are going to be made, adequate amounts of blood and other ancillary methods of surgery like the method of anesthesia are all going to be considered. Once these are put in place, usually surgeries are successful.
What are the long-term follow-up strategies for women with a history of fibroids, particularly those opt for conservative treatments?
Now, for conservative treatments, would be a patient has assessed her ability to cope with minimum interventions. Conservative would be mentioned as watchful waiting for such patients. Now, we consider the factors we consider for those set of patients are the cyclic changes cyclic hormonal changes in the female of the reproductive age. When is going to be interrupted or cease? We call that menopause. So if we have a pointer that looks at when did your mother have menopause, or when did your elder sisters have menopause at hand, and intervals are short projections, maybe 1 year, 2 year, 5 years interval, such patients would be followed up to follow them up till their menopause. However, if a patient does not fit into those categories, its patient may likely have worsening of its symptoms while opting for conservative management, and such patient may have additional management strategy or treatment strategy added to the conservative treatment that has been initially chosen.
How would you manage a patient who has recurrent fibroids after an initial treatment?
For most fibroids, they are called monoclonal tissue tumors, which means a single cell transformed into a uterine fibroid. The same response that the cell that initially transformed into the uterine fibroid could are the same types of cell in the same womb. So there could be subsequent regeneration or alteration of other normal cells to uterine fibroids. However, if a patient has been initially treated by surgical method and the recurrence of the symptoms are still severe, a second option of repeat surgery could be considered. Also, if the patient is it's assessed and is getting towards climacteric or menopause, medical treatments could be managed. It could be used to manage the patient until the patient gets into menopause. So these are either a repeat surgery or a medical treatment options are usually the methods used to follow up for patients that had the recurrence of uterine fibroid.
All right, thank you, doctor. So what is the prevalence of uterine fibroids?
The uterine fibroid prevalence, it's difficult to assess in this environment because of our health-seeking behavior. However, estimates have been done that about 20 to 30% of patients or females in this environment has uterine fibroids. However, there is a slight increase of the patients that have infertility that have been assessed to have uterine fibroid, and that increases to about 40% of patients in this environment that have coexisting infertility and uterine fibroid. Also, it has been assessed that autopsy specimen analyzing the uterus has also noted up to about 50% of females having uterine fibroid in this environment.
All right, thank you, doctor. So my next question is, why is it prevalent among Africans or Black Americans?
Okay, the cause of uterine fibroids until now has not been identified. However, it's been noted that racial differences has been noted for the existence of uterine fibroids, noting that Black Africans have the highest predisposition to uterine fibroids or highest proportion of patients with uterine fibroid. Next is African Americans, and lesser prevalence for Caucasians, which are the whites, and also the Asians. So it's been also assessed that there are some specific gene alterations or specific genes in the genes of Africans that have a significant higher response to the triggers for uterine fibroids. That's why it is more predisposed in Africans.
All right, thank you, doc. So how can public health initiatives help to improve the awareness and early diagnosis of uterine fibroids?
The symptoms of uterine fibroids, if it's okay, we can even start with the method of health assessment or health-seeking behaviors in our areas are quite poor, especially to orthodox medicine. So if we clearly make the public know that some specific symptoms, especially the ones we mentioned earlier, are caused by uterine fibroids, and they seek health care in orthodox medical facilities, we could make assessments of uterine fibroids earlier, and treatment strategies are going to be employed. And if this information is put on the media, and there is also a discouragement of African traditional medical practice assessment of uterine fibroids, if those are discouraged, then patients would have a better assessment and treatment of uterine fibroid and its complications.
All right, thank you, doc. So what is the role of lifestyle modification in prevention and management of uterine fibroid?
It's a two-way thing. The specific cause of uterine fibroid have not been identified or elucidated. However, we know that activities like dietary control, especially with respect to reduce fat or high energy dense meals, are advantageous in maintaining a general healthy style. Also, exercise have been known to improve all facets of human health. So additional use of instructing individuals to be more exercising would also have some significant improvements in the occurrence of diseases generally, and also uterine fibroid as one of the diseases that women will have.
Okay, thank you, doctor. So what is your last words?
Uterine fibroids are treatable diseases. The treatments are available even locally by gynecologists, and treatments are highly successful, especially in experienced hands.